Thank you, Dr.
Thank you very much.
Thank you, Hindi team. Now we are moving to the English session. Before beginning the session, we'll have a silent prayer. Good evening and welcome once again. Today is our 1451st day of continuous webinar. Continuously conducting this webinar is a great struggle for, great effort for many of our lovers and homeopathic doctors. I'm appreciating all the participants, faculties, those who are working behind this. Thank you so much for all of your effort. Now we got a eminent personality, eminent doctor as our guest, Dr. Rudresh. Actually, while going through his profile, he had great achievement in life. He had done many things for homeopathy. I think you all are aware about him. Even though I'm saying some of the points about him, some of the details about him. If anyone is joining as first time, means just to understand. Otherwise, he is familiar to everyone. Dr. Rudresh is MD in Homeopathy, D.Sc, and he is a PhD holder and running Ashwini Homeopathy Clinic in Bangalore, and President of Karnataka Board of Homeopathy and National Vice President of Homeopathic Medical Association of India, and former member of Executive Board of Governor Central Council of Homeopathy, Ministry of Ayush Government, India, and faculty of Rajiv Gandhi University of Health Science, Karnataka, member of Advisory Board of Jayadeva Memorial Hospital Research Center, Karnataka, expert team member of Doctoral Research Committee of Parul University, Gujarat, and member of postgraduate course in NNR Homeopathic Medical College, Telangana, former board of studies of Maharashtra University of Health and Science. And he got many awards. He has written many books. He's an author. He's a public orator. He's a documentary maker. And he presented 3,000 successful infertility cases in Greece. And counselor conducting regular webinars in international level. And he totally is a torch bearer of all aspects of homeopathy. I cannot say more words about, because if I'm saying about him, we need the entire session about him. So I'm not saying much. So I'm inviting him for the class. Sir, please. You're welcome to Ifph session. You can start now. Thank you, sir.
Namaskar. I'm audible. Am I audible?
Yes, sir. Yes, you are audible.
Yeah. जब हम डॉक्टर साहनी कभी भी बोलते रुद्रेश आ जाओ, तो मैं ना नहीं कह सकता हूँ. I mean that's the love he has got, and I retain that from my side. कभी भी, in fact, the other day when I had Hindi session, that day I had my what's so called lunch at 7 p.m. and I sat in front of the laptop at 7:30. Good evening to everyone, all the participants. I'm glad that madam was talking too high of the wo बहुत मुसीबत हो जाता है. That becomes, at least to maintain that I have to be little more cautious. ऐसा नहीं है. It's all because when you want to give your biodata, you give it. But उसको बाजू में रख दो. Don't be carried away by कार्ल एक बात बोलता है. I think लायनल मैन एक बात बोलता है, जो कविता में जो सब बोली है, सत्य उधर नहीं है, बाजू में है, थोड़ा उधर देखो करके. I mean, I certainly agree with Lionel Mann, a great man. Why I told you this, ये सभी बाजू में रखो, उसको क्या फर्क पड़ता है. मैं किधर क्या अवार्ड लिया, किधर क्या किया, किधर गया, किधर आया, वो सभी लेके क्या फर्क पड़ेगा.
Even though it is happy for us, no, that kind of.
When when I speak to my colleagues, professional colleagues, I am equally one among you. I nowhere and no way I am above the platform. ऐसा नहीं है, ऐसा नहीं होना चाहिए भी. I have completed my 42 years where I am sitting here in the same clinic, seeing 150 people per day, and people used to wait for 1 month, 2 months. Only after COVID, the waiting period has come down. But I still see 100, 120. Saturday, Monday तो और ज़्यादा बढ़ जाता है. The question is, till today, I have practiced homeopathy and what so-called homeopathy probably. And I think what I have practiced itself is a right homeopathy. And because by grace of God, I have seen literally all over India, कितना लोगों को देखा है, giving one dose, wait for 1 year, देखो miracle, वो भी देखा है. और सारा खिचड़ी करके 28 मेडिसिन इन ए सिंगल पैकेट, ये 3 महीना ले लो, उसको भी देखा है. क्या क्या नहीं देखा. I'll tell you, homeopathy is really great. सबको असर पड़ा है, सबको खाना मिला है, सबको, everybody practicing in their own way. I don't belong to any particular group, but I've learned a lot of things from ICR people. That I must give them their due. For 10 long years I was with them in the Bangalore, but I didn't stick to any group, neither I didn't follow any particular group. And I only follow Hahnemann, trying to follow. I don't say Hahnemann way. I am trying to follow the Hahnemann's teachings and his way of looking at things. And whoever Nash, Kent, Borick, Clark, जो भी बोले है, and all that. And luckily, my other thing was, I was almost क्या हुआ? Initial of my, I must tell you the evolution of the individual also, evolution of doctor also. It makes a lot of difference. The evolution of the physician makes all the sense in homeopathy. Nowhere else, I'll tell you. Physician certainly makes all the difference. 100%. Garbage in, garbage out. ऐसा भी हो सकता है. If the typically Herbert Roberts ने भी बोला, गांधी जी ने भी बोला कि the failures is of you, not of the system. तो अभी क्या करे, सक्सेस हुआ तो वो भी बोलता है ना, सक्सेस मेरा नहीं है, सिस्टम का है. फिर भी दोनों में इतना कॉन्ट्राडिक्शन. बट इन स्पाइट ऑफ ऑल दैट, आई ओ माई सिंसियर नमन टू Hahnemann and all the followers and all the my professional colleagues, not to forget my patients. My patients from 42 years, whatever I have learned is herculeously mountainous knowledge. And I have learned my 50% of knowledge, my 50% of the practice has been modified because of my patients. Lot of people used to come, high court judges, scientists, IAS, IPS, lawyers, what not, actresses, you name them, झाड़ू मारने वाली से पकड़ के, everybody has taught me a lesson. Everybody has taught me something and gone. Whatever I am today, whatever you are read, it is not just Rudresh alone. It is made up of all this society. So now I am 69. I feel it is my time to give it back. Whatever the society, whatever the homeopathy which has given me, it is my duty now to pay back time. वो मैं कर रहा हूँ, certainly कर रहा हूँ, practicing at the same place for 40 years with homeopathy and bringing results like this. It's something amazing. I have done almost around 400 television interview every week. Even now I will come live and take up all the subjects which are very very burning problem of the health. एक चीज मैंने देख चुका हूँ, क्योंकि I think Aristotle said this: if you are a straightforward man, you lose lot of opportunities. सीधा बात करने का बहुत तकलीफ होता है, nobody will tolerate, मक्खन डालने वालों को वो मिलता है, वो भी मालूम है. But never mind, it is there to be wise, and that's what Hanuman has really taught us. Anyway, before going to today's subject, I have randomly selected some cases which I felt it has to be shared with my professional beings. Not to show that I am great, not to show that I have done such a case, ये देखो मैंने क्या कर दिया. No, it's certainly not because of that. With all my humility, with all my humbleness, I would say, look, this is what I have done. And I believe that if I can do it, you can do it better. That's what I have totally in my life have done. I think we'll straight away go to cases.
Yes, sir.
These cases are all picked up from my regular practice. When you are sitting in a clinic, you can't choose your patient. A patient can choose the doctor. A doctor can never choose the patient. जो भी आता है दवा खाना खुल के बैठा है, कोई आएगा तुमको लेना ही पड़ेगा. एंड व्हेन यू आर इन ए बिगिनर, तुमको जो भी केस आता है उसको पिकअप करना ही पड़ता है. I will only see male cases, I will only see female cases, I will only see diabetes. वो मैं इस सेक्टर में मैं बहुत बड़ा हूँ, वो सभी you cannot tell. And I think you can't do that if you are a practitioner. And that's what has happened to me. I literally took cases from simple cold to cancer. Initial practice of 10 years were most of the acute cases. The place where I am practicing now, that's in Gandhi Bazaar. People high order, graduates, educated class, I would say rather most intellectual class live in here. Not now anymore, they have all sold to businessmen and they have gone away. When I started the business, and there were no nursing homes at that time, 40 years back. There were no big hospitals. All the cases every day is to have morning one round of visit to the houses, evening one round of visits. These would suffice my all acute cases. I did very well in acute cases, including diphtherias, including what so-called acute high fevers, diabetes, non-communicable disease का छोड़ो, acute cases of cholera, acute cases of what not, literally all the cases. And they would come to me because that our charges are very less. 40 years back, I used to charge 15 rupees and I would go for a visit for 10 rupees. That's where we started with. And today it has reached to the pinnacle of practice. Now I have to screen people. There were a lot of times there were lottery charges outside my clinic. It was so rushed and what not. It is not. I am not trying to boast my practice. Neither I am not trying to convey that I am great. I am only trying to tell you how arduous it was to start with my practice and to reach to this level. People have literally taught a lot of things to me, and I don't have any specific background, and I don't have any specific system or specific group or specific followership. No, I am not follower of anybody. Neither I don't have any followers. मेरा शिष्यगण नहीं है. I don't have any followers. Neither I don't follow anybody. I respect each and everyone's individuality. Let them grow up. Yes, thoda inclination towards some people may be there. And certainly I don't like to have any followers. Neither I don't like to be a follower of somebody. I had somehow developed my own way of practicing things which life has taught me. And one good thing was I was teaching for 10 long years in Government Homeopathy College, Maitreya Medica, Arganon and Medicine. It has taught me more than a student. I learned a lot of things from there. And the second thing I must mention, I must tell you that after finishing my degree in 82, for 2 long years, I was in Bombay in a leading allopathic hospital where one of the tops of India used to work as my seniors. I used to work under them, pehla junior houseman, baad mein senior houseman, then I became RMO, then almost I used to manage literally the whole hospital for 2 years. That has taught me to claim what is mine and what is not mine. I had in my practice, I have never claimed what is not mine. Patient will be very clearly told whether this case fits to homeopathic approach or not, whether I will be able to do it or not. You all know, most of the homeopaths know, when people come to you, they will come to you as a last resort. बड़े बड़े नो बड़े बड़े बंगलो, बड़े बड़े गाड़ी, बड़े बड़े इतना बड़ा बड़ा डॉक्टर, लंबी लंबी डिग्रियां and what not, such a 5-star hotel, hospitals, all that, then as a last resort they come. If you can prove yourself, this is what a practitioner can do. Now let me straight away go. You see, now when a case come to me, as I told you, I have no fixed format of case taking. Fill up करने का, ये करने का, tick mark डालने का, ये, no, I don't do all that. I just start taking the case straight away. My assistants, I have 4-5 assistant good doctors, and they take the case as it is very clearly told in the clerk, as it is told by the patient. But we pick up the repertorial language. The moment when he is talking, we convert that into repertorial language. We take the characters, we take the modality, we take sector by sector, and top of that, I would like to know, instead of most of them they see Google, most of them they have come with ready-made diagnosis. Though I give importance to that, the first and foremost thing is what the patient wants is my primary concern. And in his own language and in his own way of narration, most of the times makes my thinking and makes my prescription very well. Now, look at the chart. The first and foremost, when the patient comes to me, I will have to check out. Not all the cases have been put into characters, wo thoda leke laptop mein dal do, and you will get only sulfur, calcarea carb, lycopodium, and all leading 5 to 7 polycrest. You can't do that. First of all, you have to decide whether this case is repertorial or non-repertorial. Mind you, let us be very aware of that during Hahnemann's time, there was no repertory at all. Uska matlab ye nahi, we are all very progressed now. We are all very great people now. Literally, a lot of synthetic repertory has come, and lot of advancement, lot of research. I don't know all that has helped me or not, but certainly, what's happening? You're telling something, madam?
No, sir. No.
Okay. So I don't believe in that. I believe in whatever you have done to the patient, and patient in turn go and spread the message. Now the moment he comes, I will decide whether the case is repertorial or non-repertorial. Whether this case is acute, chronic, it needs only the indicated remedy, which you think is the simillimum. And mind you, our way of thinking and your way of thinking of that I prescribed simillimum is a retrospective thinking. When you give a medicine to any case, before giving, if you say it is a simillimum, I'm sorry, you are deceiving yourself. So, always simillimum is a retrospective thing. So, I will have to decide whether the case needs an acute prescription, whether case needs chronic remedies, constitutional one, only modalities will do, keynotes, specifics, it needs any intercurrent remedy, either a nosode or any indicated remedies, miasmatic remedies, and to erect a totality. After erecting a totality, see, somebody was joking me actually, एक केस को 5 होम्योपैथी डॉक्टर्स को दे दो, 5 लोग 5 डिफरेंट टोटालिटी एरेक्ट करेगा, and I'm sure 5 will also prescribe 5 different medicines. The question is, it is such a vast one, like a anda touching the hathi, each of one will rise to their incompetence or will rise to our incompetence and we do our best. But ultimately, it is the patient who decides. And some people say, okay, now you have given a medicine for which the patient has come. उसका कंप्लेंट अभी ठीक हो गया, अभी 3 महीने के बाद दूसरा सिम्टम आ गया, वो दूसरा खतरनाक सिम्टम आ गया. तो what have you done? Have you only transferred disease or only channelized disease from one sector to the other sector? No, you can't, when a patient comes to you, as I told you, it is the patient who chooses you. You can't choose your patient. You can't ask him to stay your lifelong, to observe him. Is that possible? One man observing the other man throughout his life? No, most of the time it is not possible. Don't be carried away by theories. It is very difficult. So, at the time of my erecting totality, what totality it came and how to erect a totality and who decides. It is not me or you who decides. It is the case. It is a symptom which decides. With this a small introduction, whatever I do, I think I would like to go to the straight away cases. The cases which I have taken, I have never meant that I will one day I will produce these cases. And if you see the videos, I have taken these videos just 1 month back. ऐसा लगा कि अरे अरे इतना cases आ रहा है, why don't we share the same thing with people? Here is a boy of 11-year-old born to a consanguineous parents, known case of congenital heart disease with albinism, congestive cardiac failure recurrent, breathlessness on exertion associated with decreased appetite, recurrent cold cough, nystagmus, diagnosed with pulmonary regurgitation, suggested to undergo surgery, pulmonary valve replacement. This is where he came to me. I must tell you, when the whole video is in Kannada, he may use some English sentences, but after the video, I will tell you what they have told you. So this is what the case has come to me. I had my own doubt of tell anything because the ejection fraction, I think here it is somewhere. No. Okay, go back. This is the birth history.
Yeah.
Medical history is pneumonia. ICR with short tap done. It's already they have done an intercostal drainage भी किया था 21 में. Balloon dilatation in 2015. PTS stenting also done in 2014. He was in such a situation when he came to me. Mixed diet, decreased appetite, they were all common symptoms, not much of importance. Investigations. You just see the investigation. Left lung severely reduced perfusion of only 18.7. Right lung is 81.3. MRI shows dilated RV intact, USD patch, LPA narrowing. Echo shows systolic obstruction, dilated right heart, pulmonary regurgitation, left ventricular ejection fraction is only 58%. Next. I did not take much time to this case, though my assistants have taken the case. I have all the reports here, which was, as I told you, I don't have a prescribed format. People started taking treatment whatever the patient tells. So I have 3 pages of that, and I have all the reports of them before and after. Now, what made me to go straight away to Kalmia? Weak slow pulse, fluttering of heart with anxiety, because I didn't take much time, I had no time, I have to see 150 patients per day. I can't afford to have spent more time with the patient. That may be my limitation. But the scope is within the available data, within the available time, what best results you can produce. I straight away selected 2 remedies. One is Kalmia because of sharp pains, frequent pulse, heart action, tumultuous, rapid, urinary frequent with sharp pains. And the second remedy which I used, then you may very simply ask, why did you have the second remedy at all? If you are honeymooning in thinking, you should have had the only remedy. लेकिन जब खाने का नहीं है, no practice, then nobody comes. Then I don't know until I give the medicine is the simillimum or not. Like William Tell, I will always have the second arrow ready-made given to him with the patient. Patients, they can't come here, wait for hours together every day. Tomorrow आ जाओ, 3 दिन के बाद आ जाओ, I can't tell that. In most of the cases, my medicines are given for a month or 2. Then also it is so much of rush. So I had to have one more remedy in my armor, which this remedy has given me more beautiful results. Arum iodide, chronic pericarditis, valvular diseases, arteriosclerosis, ozena, lupus, myomata uteri, pathological lesions, and action is powerful to gain away. Senile paresis. This is what the I selected for my prescription. This is not to teach you what this medicine is all about. I mean, this is what made me to think immediately within, after taking the case, talking to the patient, within probably I must have disposed this case in half an hour on the first time, afterwards only 5 minutes. I have followed this case from past 1 year. It's exactly 1 year. Managing, it was not difficult for me to manage the boy. It was difficult to manage the next man who is sitting there, that is his father. He was too anxious because they told that open heart surgery can lead to anything. We are not very sure, but you have to go for surgery. That's what the whole thing is given. Now this fellow, this Yusuf, Tanvir, Syed Tanvir's. This Syed Tanvir's case is that he speaks in Kannada. Of course, the boy speaks in English. I will, at the end, I will tell you what has happened before the treatment and after the treatment. Play the video. Sound ಇಲ್ಲ. ಅವನೇನು ಹೇಳ್ತಾ ಇದ್ದಾನೆ.
ಹೇಳಪ್ಪ, ಏನೇನು ನಿನ್ನ ಹೆಸರು?
Though the conversation is in Kannada, I will tell you later.
How old are you?
Okay, sir.
12 years old. ಹೇಳ್ರಿ, ನೀವು ಹೇಳ್ರಿ. ಲಾಸ್ಟ್ ಇಯರು ಇಲ್ಲಿ ನಮ್ಮ ಹತ್ರ ಬಂದಾಗ ಏನೇನು ತೊಂದರೆ ಇತ್ತು, ಈ 1 ವರ್ಷದಲ್ಲಿ ಏನೇನು ಅನುಕೂಲ ಆಗಿದೆ ಅದ ಹೇಳಿ.
ಲಾಸ್ಟ್ ಇಯರ್ ಪಲ್ಮನರಿ ವಾಲ್ ರಿಪ್ಲೇಸ್ ಮಾಡಬೇಕಂತ ಡಾಕ್ಟರ್ ಅಡ್ವೈಸ್ ಮಾಡಿದ್ರು ಸರ್ ಅದು. ಸೊ ಇವಾಗ ಎಸೆನ್ಷಿಯಲ್ ಇಲ್ಲ, ಮುಂದೆ ನೋಡೋಣ ಅಂತ ಹೇಳ್ತಾರೆ ಸರ್. ಸ್ವಲ್ಪ ಆಪರೇಷನ್ ಮಾಡುವಂಥ ಸಿಚುವೇಶನ್ ಇಲ್ಲ, ಸ್ವಲ್ಪ ಮುಂದೆ ನೋಡೋಣ ಅಂತ ಹೇಳ್ತಾರೆ ಸರ್ ಅವರು.
ಈಗ ಏನೇನು ಅನುಕೂಲ ಆಗಿದೆ 1 ವರ್ಷದಲ್ಲಿ ನಮ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್ ಶುರು ಮಾಡಿದ ಮೇಲೆ ಏನೇನು ಅನುಕೂಲ ಆಗಿದೆ?
ಒಳ್ಳೆ ಕನ್ಸಂಪ್ಷನ್ ಆಫ್ ಫುಡ್ ಜಾಸ್ತಿ ಆಗಿದೆ ಸರ್ ಒಂದು, ಆಮೇಲೆ ಹೈಟ್ ಜಾಸ್ತಿ ಆಗಿದೆ, ಆಮೇಲೆ ವೇಟ್ ಜಾಸ್ತಿ ಆಗಿದೆ.
ವೆರಿ ಗುಡ್.
ಆಮೇಲೆ ಪಲ್ಪಿಟೇಷನ್ ಇತ್ತು, ಪಲ್ಪಿಟೇಷನ್ ಕಡಿಮೆ ಆಗಿದೆ ಸರ್ ಅವರಿಗೆ. ಸ್ವಲ್ಪ ಓಡಾಡ್ಕೊಂಡು ಬಂದರೆ ನಮ್ಮ ಸ್ವಲ್ಪ ಡಿಫ್ರೆನ್ಸ್ ಆಗಿದೆ ಸರ್, ಡಿಫ್ರೆನ್ಸ್ ಆಗಿದೆ ಸರ್.
ಎಜೆಕ್ಷನ್ ಫ್ಯಾಕ್ಷನ್ನು
ಲಾಸ್ಟ್ ಇಯರ್ ಕಡಿಮೆ ಇತ್ತು, ಇವತ್ತು ಈ ಸಲ 71 ಆಗಿದೆ.
71 ಆಗಿದೆ. ವೆರಿ ಗುಡ್, ವೆರಿ ಗುಡ್. ಈಗ ಹಂಗಾರೆ ಈ ಸರಿ ನೋಡಿದವರು ಈ ಸರಿ ಎಕೋ ಮಾಡಿ ಬೇಡ ಅಂದ್ರ?
ಎಕೋ ಮಾಡಿ ಸದ್ಯಕ್ಕೆ ಸರ್ಜರಿ ಅವಶ್ಯಕತೆ ಇಲ್ಲ, ಮುಂದೆ ನೋಡೋಣ ಕಂಡೀಷನ್ ನೋಡ್ಕೊಂಡು.
ಇಂಥದ್ದ ಓಕೆ, ಯಾಕೆ ನಿಲ್ಸಿ?
ವಾಲ್ಯೂಮ್ ಜಾಸ್ತಿ ಮಾಡಿ.
ಹಾಂ, ಅಲ್ಲ ಅದು ಕಂಟಿನ್ಯೂ ಮಾಡಿ. ಅದು ಇಟ್ ಈಸ್ ಇಲ್ಲಿ ಬರಲಿ ಮತ್ತೆ ಮೊದಲಿಗೆ ಹೋಯ್ತು.
ಇವಾಗ ಎಸೆನ್ಷಿಯಲ್ ಇಲ್ಲ, ಮುಂದೆ ನೋಡೋಣ ಅಂತ ಹೇಳ್ತಾರೆ ಸರ್. ಸದ್ಯಕ್ಕೆ ಸ್ವಲ್ಪ ಆಪರೇಷನ್ ಮಾಡುವಂಥ ಸಿಚುವೇಶನ್ ಇಲ್ಲ, ಸ್ವಲ್ಪ ಮುಂದೆ ನೋಡೋಣ ಅಂತ ಹೇಳ್ತಾರೆ ಸರ್ ಅವರು.
ಈಗ ಏನೇನು ಅನುಕೂಲ ಆಗಿದೆ 1 ವರ್ಷದಲ್ಲಿ ನಮ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್ ಶುರು ಮಾಡಿದ ಮೇಲೆ ಏನೇನು ಅನುಕೂಲ ಆಗಿದೆ?
ಒಳ್ಳೆ ಕನ್ಸಂಪ್ಷನ್ ಆಫ್ ಫುಡ್ ಜಾಸ್ತಿ ಆಗಿದೆ ಸರ್ ಒಂದು, ಆಮೇಲೆ ಹೈಟ್ ಜಾಸ್ತಿ ಆಗಿದೆ, ಆಮೇಲೆ ವೇಟ್ ಜಾಸ್ತಿ ಆಗಿದೆ.
ವೆರಿ ಗುಡ್.
ಆಮೇಲೆ ಪಲ್ಪಿಟೇಷನ್ ಇತ್ತು, ಪಲ್ಪಿಟೇಷನ್ ಕಡಿಮೆ ಆಗಿದೆ ಸರ್ ಅವರಿಗೆ. ಸ್ವಲ್ಪ ಓಡಾಡ್ಕೊಂಡು ಬಂದರೆ ದಮ್ ಆಗ್ತಿತ್ತು, ಇವಾಗ ದಮ್ಮು ಸ್ವಲ್ಪ ಡಿಫ್ರೆನ್ಸ್ ಆಗಿದೆ ಸರ್, ಡಿಫ್ರೆನ್ಸ್ ಆಗಿದೆ ಸರ್.
ಎಜೆಕ್ಷನ್ ಫ್ಯಾಕ್ಷನ್ನು
ಲಾಸ್ಟ್ ಇಯರ್ ಕಡಿಮೆ ಇತ್ತು, ಇವತ್ತು ಈ ಸಲ 71 ಆಗಿದೆ.
71 ಆಗಿದೆ. ವೆರಿ ಗುಡ್. ವೆರಿ ಗುಡ್. ಈಗ ಹಂಗಾರೆ ಈ ಸರಿ ನೋಡಿದವರು ಈ ಸರಿ ಎಕೋ ಮಾಡಿ ಬೇಡ ಅಂದ್ರ?
ಇಕೋ ಮಾಡಿ ಸದ್ಯಕ್ಕೆ ಸರ್ಜರಿ ಅವಶ್ಯಕತೆ ಇಲ್ಲ, ಮುಂದೆ ನೋಡೋಣ ಕಂಡೀಷನ್ ನೋಡ್ಕೊಂಡು ಮುಂದೆ ಮಾಡೋಣ ಅಂತ ಹೇಳ್ತಾರೆ.
ವೆರಿ ಗುಡ್. ನೀನು ಹೋದ್ ಸರಿಗೂ ಈ ಸರಿಗೂ ಹೆಂಗಿದ್ಯೋ ಹೇಳು. ಹೌ ಆರ್ ಯು ಫೀಲಿಂಗ್ ಆಫ್ಟರ್ ಲಾಸ್ಟ್ ಟೈಮ್? ಇನ್ 1 year, what is the improvement that you have seen?
The consumption of food is increased, and the height is increased, weight also increased. Then there is no palpitation. Then when in last year when I was running, I was taking
Deep breaths.
but now it is decreased.
Decreased. So you are better in 1 year, what you were and what you are, right? Right. Thank you.
See, this case, that father who spoke was most anxious man. Oh, mera jaan kha liya. I was to give up that case actually because of his nagging attitude. Sir, hota hai. I can understand as a father, but I am also a doctor. How much to listen and how much to take? उसका सभी मेरे ऊपर इतना क्यों लेने का एंड कितना लेने का एंड वाई? तो मैंने बोल दिया देखो तुम मेरे को इतना सताया, आई थिंक लीव दिस केस. तो उन्होंने he held him back and every month he comes from another 450 kilometers from Bangalore, known as Yadgir, near Gulbarga district. Every month he used to come, take the medicine and go. Every month he improved, and today after 1 year he underwent all the tests which he had come to me. When he had come to me, the second test is there. This video was recorded on 15/7/24. The echo shows the echo was 58% last year before I started my medicine, and today it has come to 71%, and weight has increased by 5 kg. Weight has increased by 5 kg in 1 year, and height has increased by 1.5 inch. His appetite increased. Dyspnea on exertion, सीढ़ी चढ़ने से, भागने से, used to get palpitations, that has totally come down. He is like any normal. All the tests and the cardiac surgeon who has seen him now very clearly told he don't need any operation, neither replacement of valve. This is what one can do, and this is what these two medicines. I have given Kalmia as the main remedy. I used to give Kalmia for 3 days, wait for 1 week, give Aromaridate 1 ml, 1 week, again gap. The only 2 remedies. What I have not written here is, as a principle, in all the chronic cases, I prescribe 1 dose of miasmatic remedy, which I think is right, which I feel has done wonders when the indicated remedy fails. In his case, I have given Syphilinum 1 ml. महीने में 2 महीने में एक बार Syphilinum 1 ml I had given in this case, which I have not mentioned here, which all my cases, whatever you see, they receive an intercurrent remedy, either tuberculinum or sorinum or medorinum, or then you may ask, when you ask for the similimum, where is the idea of prescribing all that? No, this is the practice that which I have done in 40 years, which has paid me result. That's why I am sharing with you. My second case is a recurrent case of warts. अरे वार्ट में क्या है यार, मैंने तुझा दे दिया, ठीक हो गया. Allopathy doctor, skin specialist in Bangalore, now they also have a tuja external application and tuja 30 in their shelves actually. They too have it. So warts mean tuja. चलो इसमें इस केस में क्या हुआ था, that girl also had callosities on the foot. She couldn't walk. The worst thing was, top of all that warts which she had it cautery done multiple times. जब भी whenever the cautery was done, there was bleeding, excessive bleeding, she would blow with big pain. It was so difficult for her to tolerate, and she was taking her SSLC exams. Along with that, she also got in the foot, she started getting callosity. This is the time when she came. Family history, diabetes mellitus was both on the paternal side and mother side. I always think any tumors, any hard callosities, any hard nodules, myomatas and uterine fibroids, all this, if there is a strong history of diabetes, I always prescribe a dose or two of uranium nitricum as a principle. So I thought, okay, if all the things fails, let me go to uranium nitricum was my thinking, though which I did not do. The only two remedies I used in this case is one is antimonium crude and second was Tuja. Tuja I gave only after all the warts and all the callosities have gone, only to say that at least the miasm should not continue and produce some proliferation somewhere else. So that was my conceptual thinking, so that I gave Tuja. Tuja was not the curative remedy. Only antium crude was the curative remedy. Look how my grandmother describes what happened. Though it's in Kannada, I will let you know.
ಎಲ್ಲಿತ್ತು ಯಾವ ಕಾಲಲ್ಲಿ ತಾಂಡ ಏನ್ ಮಾಡಿಸೋದಕ್ಕೆ
ಬರ್ನ್ ಮಾಡಿಸಿ ಮೂರು ಸತಿ ಎರಡು ಸತಿನೂ ಮಾಡಿಸಿದ್ವಿ ಬರ್ತಾನೆ ಇತ್ತು ಬರ್ನ್ ಮಾಡಿದ್ರೆ ಬರ್ತಾನೆ ಇತ್ತು ಕೈಯಲ್ಲಿ ಬರೆಯಕ್ಕಾಗ್ತಾ ಇರ್ಲಿಲ್ಲ ಈಗ ಮಾರ್ಕು ಇಲ್ಲ
ಏನ್ ಮಾಡುತ್ತಾ ಇದ್ಲು ಅವಳು
ಬರೆಯಕ್ಕಾಗ್ತಾ ಇರ್ಲಿಲ್ಲ SSLC ಅವಾಗ ಕಷ್ಟ ಆಗ್ಬಿಟ್ಟಿತ್ತು ಬರೆಯೋದಕ್ಕೇನೆ ಅಳ್ತಾ ಕೂತ್ಕೊಂಡ್ಲು ಯಾವ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋದ್ರು ಅದನ್ನ ತೆಗಿತಾರೆ ತೆಗೆದ್ಮೇಲೆ ಮತ್ತೆ ಹಂಗೆ ಪಕ್ಕನೇ ಬರ್ತಾನೆ ಇರುತ್ತೆ ಆ ಪಕ್ಕನ ಕಾಲಲ್ಲೂ ಅಷ್ಟೇ ಪಕ್ಕ ಬರ್ತಾನೆ ಇರುತ್ತೆ ಮಾಡ್ಬೇಕಾದ್ರೆ ಹಿಂಸೆ ಎಷ್ಟು ರಕ್ತ ಹೋಗುತ್ತೆ ಅಳೋದು ಅಷ್ಟು ಬಡ್ಕೊಳ್ತಾ ಇದ್ದು ಇಲ್ಲಿ ಬಂದು 15-20 ದಿವಸದಲ್ಲಿ ಒಂದು 2 ತಿಂಗಳ ಔಷಧಿ ಕೊಟ್ರಿ 15 ದಿವಸದಲ್ಲಿ ಅವಳಿಗೆ ಎಲ್ಲಿದೆ ಅಂತಾನೆ ಗೊತ್ತಿಲ್ಲ
ಮತ್ತೆ ಈಗ ಎಲ್ಲ ಆಪರೇಷನ್ ಚಾರ್ಜ್ ಎಲ್ಲ ನಂಗೆ ಕೊಡ್ರಿ ಇವಾಗ
Look at this. She had to undergo an SSLC examination. Her right thigh had lot of multiple warts there, cauterized 3-4 times and used to bleed. She would hell almost bombard with pain and she couldn't tolerate. Every time they have taken to almost 3 to 4 doctors. At the same breath, now when she came to me, she also had the callosity on the foot which she couldn't walk. She couldn't walk, she couldn't write. Then I somehow felt antium crude was the remedy. I gave her, as I told you, people can't every day come, every 3 days come and wait here in my consultation room. It's humanly impossible. So in chronic cases, I will ask them to come 1.5 months. I had given medicine, first antium crude and sent them. The lady, the grandmother who told you, you must have heard, you had given me medicine for 2 months to carry, to come back after 2 months. After 15 days of your medicine, we were searching where did these warts went, where did that callosity went, how much money we have spent, how many doctors we have seen. Though it looks like a simple case, why I am sharing with you the joy which the family enjoys. Though it looked like a small wart, what is their big thing? But an SLC girl, if she can't write exams, it makes all the sense to her. So it was later stage I gave Tuja one name. It's almost, I think, when I recorded it was somewhere around Manasana. It was 2 months back and she finished her degree and now she has gone to college. Next one please. This was one case which which really perturbed me when the patient came to me first. This was a 17-year-old girl who was brought to me, diagnosed as Mullerian agenesis, primary ovarian failure, Turner syndromes, with subclinical hypothyroidism. History of mother having mental depression during pregnancy. Appearance was very short stature with small webbed neck. Menarche not had happened. Family history of there was nothing much except diabetes. They were vegetarians basically. Regular bowel movements. There was nothing general things. But what was more astonishing and shocking to me was the investigative reports. What's that? Estradiol was totally decreased. There is hypoplastic uterus which clearly suggests the agenesis, Mullerian agenesis, thin ovaries, and scan showed hypoplastic uterus with thin endometrium of the uterus. In fact, uterus was not visible. That's what the doctor has told and sent. Why it is more important to me, when they brought I told you, whatever they have the reports with them, whatever the best and the better doctor of the city with their versions, their diagnosis, patient suffering, whatever it is. First thing I will talk to patient, what is your problem? When I asked the girl was told that she is a girl. She was certainly not looking like a girl. He was looking like a man, like how we all have been described in Boric. Sepia में वो जो बोलता है ना, straight from the shoulders, 24, 24, 24. No 36, 24, 36. It is 24, 24, 24. Typically that male gynae waist, looking like a boy, thin, withered away. I just asked her one single question. Yenama, what is your problem? With characteristics she told. कोई लड़का मुझे नहीं देखता है. That was her problem. Her problem was not Mullerian agenesis. Mullerian agenesis मेरा दिमाग का रहा था. उसका problem का कोई लड़का मेरे को नहीं देखता है क्लास में. That was her complaint. She was looking like that. I'll tell you. I took this case, treated for 10 long years from 2014 to 2024. Her first visit was 15/9/14. That was the first visit. And what so called this video which I shot, though it's Kannada, probably it was shot only recently, otherwise I would have made English subtitles, which I was unable to do. Probably in future I may have to engage somebody, and in the busiest practice of mine, I can certainly record minimum 4 to 5, believe it or not, cases every day. One cameraman, one room and one case with one case sheet. I could bring in lot of cases which were unheard of even to me. Forget about others, to me also. So this case I treated for 10 long years, and this was shot on 16th or 28th video recording. 28/5/24 video recording done. Look, unfortunately I am unable to show the first day photo which they have promised me to get it. First day when they came, how was the photo, and look now how she looks. And see, what are the remedies? Only 2 remedies. Beretta-carbonum, aurum muro-natronatrum is the second remedy. Only these 2 remedies. I must tell you the same story again. What I have not mentioned here while doing the case, in between a dose or 2 of psychosyphilinum, a combination of psychosyphilinum and syphilinum has been given in this now and then intercurrently. Look at here.
ಡೆವಲಪ್ಮೆಂಟ್ ಇರಲಿಲ್ಲ. ಪುಟ್ಟ ಮಗು ಥರ 5 ವರ್ಷದ ಹುಡುಗಿ ಥರ ಇತ್ತು. ಇನ್ನು ಮೆಚೂರ್ ಆಗಿರಲಿಲ್ಲ. ಮುಲ್ಲೇರಿಯನ್ ಏಜೆನ್ಸಿ ಅಂತ ಇದರಲ್ಲಿ ಸ್ಕ್ಯಾನಿಂಗ್ ರಿಪೋರ್ಟ್ನಲ್ಲಿ ಬಂದಿತ್ತು. ಅದಕ್ಕೆ ಇವರು ಎಂಡೋಕ್ರೈನಾಲಜಿಸ್ಟ್ ಹತ್ರ ತೋರಿಸಿದಾಗ ಅವರು ಒಂದು ಪ್ರಿಮಾರಿನ್ ಇದನ್ನು ಕೊಟ್ಟರು. ಅಷ್ಟಾದ್ಮೇಲೆ ನಾವು ಅವರು ನೋಡಿಕೊಂಡು ಬರ್ತಾ ಇರ್ತೀವಿ. ನಿಮ್ದೊಂದು ಟಿವಿ ಸಂದರ್ಶನ ನೋಡಿದ್ಮೇಲೆ ಇಲ್ಲಿಗೆ ಕರ್ಕೊಂಬಂದ್ವಿ ನಾವು. ಯಾವಾಗದು? ಟಿವಿಲಿ 14th ನೋಡಿದ್ವಿ.
2014 ಶುರು ಮಾಡಿದ್ವಿ, ಟ್ರೀಟ್ಮೆಂಟ್ ಶುರು ಮಾಡಿದ್ದು.
ಟ್ರೀಟ್ಮೆಂಟ್ ಶುರು ಮಾಡಿದ್ದು.
ಅವತ್ತು ಹೆಂಗಿದ್ಲು, ಇವತ್ತು ಹೆಂಗಿದ್ದಾಳೆ?
ಅವತ್ತು 5 ವರ್ಷದ ಮಗು ತರ ಇತ್ತು, ಇವಾಗ 14 ವರ್ಷದ ಹುಡುಗಿ ತರ ಆಗಿದ್ದಾಳೆ.
ಈಗ ಎಷ್ಟು ವಯಸ್ಸು ಅವಳಿಗೆ?
ಈಗ 26 ತುಂಬಿತು ಈಗ.
ಅವಳೇನೋ ಬಹಳ ಡಿಪ್ರೆಷನ್ಗೆ ಹೋಗಿ ನನ್ನ ಯಾರು ನೋಡೋದೇ ಇಲ್ಲ ಅಂತ ಇದ್ಲು ಒಂದು ಕಾಲದಲ್ಲಿ.
ಇನ್ಫೀರಿಯಾರಿಟಿ ಕಾಂಪ್ಲೆಕ್ಸ್ ಬಂದಿತ್ತು ಅವಳಿಗೊಂದು ಸ್ವಲ್ಪ. ಪುಟ್ಟ ಮಗು ತರನೇ ಇದ್ದೀನಿ ಅಂತ ಈಚೆ ಆಚೆ ಓಡೋದಕ್ಕೆ ಮುಜುಗರ ಪಡ್ತಾ ಇತ್ತು. ಈಗ ಯಾರು ನೋಡಿದ್ರು ಒಬ್ಬ ಇದು ಏನು ಮಾಡಲ್ಲ.
ಈಗ ನೀನ್ ಹೇಳು, ಅವತ್ತು ಹೆಂಗಿದ್ದೆ, ಇವತ್ತು ಹೆಂಗಿದೆ?
ಚಿಕ್ಕ ಹುಡುಗಿ ಅಂತಾನೆ ಇದು ಮಾಡ್ತಾ ಇದ್ರು ಎಲ್ಲರೂ. ನೋಡಕ್ ತುಂಬಾ ಚಿಕ್ಕ ಹುಡುಗಿ ತರ ಅಂತ. ಈಗ ಎಲ್ಲರೂ ಎಷ್ಟು ಚೇಂಜಸ್ ಆಗಿದ್ದಾರೆ ಅಂತ ಆಶ್ಚರ್ಯ ಪಡ್ತಾ ಇದ್ದಾರೆ.
ನಿನ್ಗೆ ಏನೇನು ಚೇಂಜಸ್ ಆಗಿದೆ? ಒಂದು ಹೆಣ್ಣಿಗೆ ಏನೇನು ಸೆಕೆಂಡರಿ ಸೆಕ್ಷುವಲ್ ಕ್ಯಾರೆಕ್ಟರ್ಸ್ ಅಂತ ಕರಿತೀವಿ, ಅಂದ್ರೆ ಕೂದಲು, ಬ್ರೆಸ್ಸು, ನೀನು, ನಿನ್ ಮುಖ ಎಲ್ಲ ಬದಲಾಗಿದೆ. ಅದರಲ್ಲಿ ಯಾವ್ದು ನಿನಗೆ ಯಾವ್ದು ಇಂಪಾರ್ಟೆಂಟ್ ಅನ್ಸುತ್ತೆ? ನಿನಗೆ ಯಾವುದು ನಿಜಕ್ಕೂ ಬದಲಾಗಿದೆ, ನಿನ್ನ ಇಂಪಾರ್ಟೆನ್ಸ್ ಪ್ರಕಾರ ನನಗಿದು ಬಹಳ ಮುಖ್ಯ ಅನ್ನಿಸ್ತು ಅನ್ನೋಂಥದ್ದು ಯಾವುದು?
ಎಲ್ಲಾನು ಸಮಾಧಾನಕರವಾಗಿದೆ. ಮೊದಲೆಲ್ಲ ಇದ್ದಿದ್ದಕ್ಕಿಂತ ಈಗ ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಫುಲ್ ಎಲ್ಲಾದ್ರೂ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿ ಎಲ್ಲ ಚೇಂಜಸ್ ಕಾಣ್ತಾ ಇದೆ. ಈಗೆಲ್ಲ ಒಳ್ಳೆ ಡೆವಲಪ್ ಇದಾಗ್ತಾ ಇದ್ದೀನಿ, ಎಲ್ಲ ಚೇಂಜಸ್
ನಾರ್ಮಲ್. ಈಗ ನಾರ್ಮಲ್ ಹುಡುಗಿ ತರ ಅನ್ಸುತ್ತೆ ನಿಂಗೆ?
ಅನ್ಸುತ್ತೆ.
ಸೊ ಕಾಲೇಜ್ ಹೋಗ್ಬೋದು ಅನ್ಸುತ್ತೆ. ಹುಡುಗರೆಲ್ಲ ನೋಡ್ತಾರ ಇವಾಗ?
ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ಸಿದ್ರೆ ಇನ್ನೇ ಒಂದು ಅರ್ಧ ಇಂಚಷ್ಟು ಡೆವಲಪ್ಮೆಂಟ್ ಆಗ್ಬೋದು ಅಷ್ಟೇ, ಹೈಟ್ ಬರ್ಬೋದು ಅಷ್ಟೇ ಅಂತ ಹೇಳಿದ್ರು. ಆದ್ರೆ
ಏನು ಸರಿ ಹೋಗಲ್ಲ ಅಂತ ಹೇಳಿ ಅವ್ರು ಏನ್ ಹೇಳಿದ್ರು?
ಏನೇನು ಸರಿ ಹೋಗಲ್ಲ ಇಷ್ಟೇನೆ ಅಂತ ಹೇಳಿದ್ರು. ಆದ್ರೆ ಏನನ್ನ ಬೈ ಲಕ್ಕೀಲಿ ಲಕ್ಷದಲ್ಲಿ ಒಬ್ರು ಸರಿ ಹೋಗ್ಬೋದು ಅಂತ ಹೇಳಿದ್ರು. ಆದ್ರೆ ಮುಂದೆ ಬರ್ತಾ ಇರಿ ನೋಡೋಣ ಅಂತ ಹೇಳಿದ್ರು. ನಮ್ಗೆ ಏನೋ ಸ್ಯಾಟಿಸ್ಫ್ಯಾಕ್ಷನ್ ಆಗ್ಲಿಲ್ಲ, ನಾವು ಇಲ್ಲೇ ಟ್ರೀಟ್ಮೆಂಟ್ ನ ಕಂಟಿನ್ಯೂ ಮಾಡಿದ್ವಿ. ಅದೇ ಮೆಪ್ರೇಟ್ ಕೊಡಕ್ ಹೇಳಿದ್ರು. ಮೆಪ್ರೇಟ್ ನ ಬೇಡ ಅಂತ ನೀವು ಹೇಳಿದ್ವಿ. ಮೆಪ್ರೇಟ್ ನಾವು ಕೊಡ್ತಾ ಇಲ್ಲ, ಮೊದಲಿಂದ ಕೊಡ್ತಾ ಇಲ್ಲ. ಇಲ್ಲಿ ಬಂದ್ಮೇಲೆ ನ್ಯಾಚುರಲ್ ಆಗಿ ಒಂದ್ಸತಿ ಆಗಿದೆ. ಆಗಸ್ಟ್ನಲ್ಲಿ
This is the letter written to me in 1/1/24, which is in Kannada. You should really keep this as a token of souvenir of that girl who has written. Her mother has told what is Manasa, how she was a 5-year-old boy-like girl whom I brought to you 10 years back. Every year we started seeing the improvement. Now, most importantly, all her secondary sexual character, and they have told them very clearly. Endocrinologist has very clearly told her. They told we will give Meprate and Premarin. I said stop it. You don't know whether that works. They said very clearly. When I said no, they stopped that.
Now she's looking pretty, and even what she's telling we can understand, even though we don't know Karnataka, but Kannada, and even though we can understand what she's saying.
No, the most important thing, I asked one question now. I said, no, are the boys looking at you now?
Yeah, I understand.
So, for her concern was that actually.
Yeah.
Concern was that. I must tell you, today she looks like a heroine. On the first,
Exactly.
I'll certainly try to get the first photo. See the difference in 10 years. And of course, I had faith in my system. I had faith in me. That's why I continued. Endocrinologist very clearly told we cannot do anything more than this. At the most, what we can do is, if you can't do anything, at least let her be like this. No uterus thing. Now she started getting menses. Uterus are developed. Ovaries have started function. As I told you, only 2 remedies, Bertacarb and Auromironatrinatrum. One or two doses in between. When she was under depression and her characters were typically managing the college show, and her problem was all the boys and girls mixes each other. I am left alone. That has gone now. She's been accepted that she is one among her contemporary colleagues or contemporary classmates, and she mingles with them, and top of that she looks like a woman. That's what she told. Now her all secondary sexual characters, pubic hairs, axillary hairs, breast, even the vagina, literally she has bloomed like a flower, like a flower she has done. and this is what that one can do in 10 long years. It took 10 years for me. Okay.
Sir, I think it is better to stop with the 3 cases, because if we have started this, means we have only 9 minutes to finish. So I
Okay,
think
now
we'll
okay.
give. What, sir?
ಈ ಕೇಸ್ ಹಾಕ್ಬಿಡಿ.
ಹೇಳಿ ಈಗ ಸುಮನ್ಯ
Now we will go for discussion for the 8 minutes. That will be nice. Otherwise,
Okay, then I will stop at this. I have 2 more cases. I will stop at this.
actually we need all the cases for
Leave it now. Now it is very clear that I always stuck to the principle, as I told you, since I was also a teacher for 10 long years in government college. I always believed that materia medica, organon and repertory, all the 3 go hand in hand. I am not a doctor who give one medicine to one disease. No way, no way. I really understood the depth of homeopathic understanding, both understanding the intrapersonal relationship of the family, society and the work spot. I will have to take all the consideration. Typically, you also know that we don't believe only the parasites and viruses. They causes some infections and they causes something, and you have to name a disease and prescribe a medicine. I believe that knowledge of disease, knowledge of medicine, knowledge of potency reputation, knowledge of miasm and knowledge of susceptibility plays the highest role. All this I may not able to suddenly explain in 10 minutes, but I should able to understand comprehensively the moment patient sits in front of you. Somebody was probably asked last time, what was the criteria of selecting 1M, what was the criteria of the selecting 200 and potency, and I always believed the potency selection, certainly there is a logic behind that. The seat of the disease, depth of the disease, virulence of the disease, susceptibility of the individual. These 4 things match the selecting the potency. And I think with this I will stop now. What's the time?
And now it is 54, sir. We have 6 more minutes. If anyone have questions, please raise your
I
hand.
think I'll stop at this. Thank you very much.
Thank you so much, sir. It
for
is
having given me the opportunity.
it's a
And,
great
all
opportunity
the-
for us to receive this kind of miraculous cures and case presentation.
That's
Really,
exactly.
really wonderful.
And I certainly believe that if I can do, you can also, anybody can do it.
Yes, sir.
Provided
This is-
if they have little sense, little head, don't be carried away, don't belong to any group, don't be carried away by this method, that method, this protocol, this cancer protocol, this call. No way. I'm telling you, no way. Stick to Hahnemann principle. You cover all the concepts, cover materia medica, repertory and organon. I think with this, if anyone wants to.
Okay, sir. I don't know the name of the person. Motorola. You can unmute yourself. Please put your names in the Motorola. You can.
How many are in the room, madam? Today, how many are in the room?
47, sir.
47. Okay.
Please unmute yourself and ask question. Oh, sorry. I don't know. Please unmute. Please unmute yourself and ask the question.
Go to the next.
Okay. Dr. Ram Parvesh, sir. Unmute yourself, sir. I'm sending you the. Okay. After I send. Wait. Okay. Oh, sorry. Okay.
Thank you, Dr. Anjani and Dr. Bhai Rudresh ji.
Yes, sir.
You are Vice President HMI. I am Vice President Bihar Branch HMI. Dr. R.P. Shah, I am a Dr. R.P. Shah. Call meet the Delhi conference. Very thanks. Excellent session. a case, evidence-based case, according to homeopathic philosophy and curative way of treatment. There are three angles: symptomological angle, miasmatical angle, and pathological angle. So, curative way of angle, miasmatical angle is the curative way of angle. So, you are very nice presentation, excellent session, case 4 case. Very, very thanks, Dr. Rudresh.
Thank you, sir. Thank you, Dr. Ram Parvesh, sir.
Thank you.
Now, Dr. Bob Lim, you can please, Dr. Bob Lim. Really, it was a wonderful experience for us. And as you told, from every person, everywhere, we are getting an information, and that will help us to lead our practice. Even though, even all field of life, it is very necessary to learn from everyone, not from the bigger personalities, not from this kind of person. As you told, that is a great message for today's session. You have to learn from everyone. Dr. Bob Lim.
Hello.
Yes, audible.
Oh, you're calling me. Okay. That is a very, very informative sharing by Dr. D.T. Rudresh, and a very patient doctor. He never give up when taking the case and always follow their classical way of treating cases. And he has so many cases to share. So I'm also waiting for the other cases which he cannot complete today. So thank you very much, Dr. B.T. Rudresh, for sharing tonight.
Not only you, doctor, every one of us are waiting for to see the other cases also. But we have time. This is a continuous process.
So we hope you will to finish all the other cases which you would like to share tonight. And I hope that Dr. Ajini will also arrange for him to continue the case again, all the cases which he had to share with us. And thank you very much. It's a very, very informative sharing tonight.
And Dr. Bob Lim and other personalities, if you have any queries, means you can send to Dr. Rudresh mail, and you can clear your doubts. I mean, if any important cases, means he will help you.
Yeah, thank you very much. It's a very good
such a person to give, share the knowledge. Like to share the knowledge. So it is he's joining with us. That is a great achievement for us. And now it is 59. And you please say out of thanks to Dr. Rudresh. Dr. Bob Lim, you can say out of thanks to Dr. Rudresh.
Okay. On behalf of the Ifph, I would like to show and our deepest appreciation to Dr. B.T. Rudresh for sharing so sincerely tonight's webinar. And it's very, very informative and very good for all of us who have attended tonight. So once again, thank you very much, Dr. B.T. Rudresh, and I hope to be
Thank you.
Thank you so much, sir. Now it is the time for the Malayalam session. I am inviting Dr. P. Shaila. Who is moderating today? Dr. P. Shaila or Dr. Mariam Majon? Please, I am welcoming the Malayalam moderator to conduct the Malayalam session. Thank you so much, sir. And
Thank you. Very, very thanks.
See you at the same time tomorrow. Love you. Good night.